And welcome back. Well, you've probably heard the children's song that says, are you ready for it? The
Sing
leg
it.
bone connected to the knee bone connected to the thigh bone. Everybody knows it. You're all doing it at home. It's like the domino effect.
And there's a reason why our producer decided that Tiffany should sing that rather than me. And it's because
so
I can't carry a tune. So when it comes to your health care, looking beyond the obvious, are your symptoms the first or the last domino to fall? Well, here with ways to see if your medical condition is connected to another health issue that you may not have thought of is Dr. Madan Kandula with Advent. You want to sing it with us now?
No, I'm not a singer.
I'm
no.
with you. So how do you define this domino effect in your medical practice? Because the thing that always strikes me is that people have symptoms often for such a long time before they seek help.
Absolutely. And a lot of times, especially with the areas that I deal with up in the head and neck, folks focus on the thing that's the most obvious. For me right now, I've got a cold. My throat, my voice doesn't sound particularly good, but that's not where the issue is starting from. It's starting from up here with kind of the mucus factory I got going on right now. So, but that's it. I mean, it's basically focusing on the issue at hand when that issue may be very well the last domino versus the first domino to fall.
Okay.
Well, yeah, and talk about some of the issues that you see in your office, because ear infections, very common.
Yep, absolutely.
Do you ever have ear infections that are not related to the ear?
Yeah, oftentimes. I mean, that's a pretty typical thing that I see. Someone will come with, you know, it's obvious, my ear is killing me, my ear is plugged, whatever the case may be, but you've got to sort of scratch beneath the surface, and very, very often we find that it's not just the ear, there's something else that's happening that's causing the trouble. The ear, specifically, there's a tube that connects the ear to the back of the nose, and so oftentimes when somebody is having ear issues, especially an adult, they actually are having issues up ahead of that, like the sinuses and the nose, so like a sinus infection, that kind of thing.
And I'm glad you brought up adults, because I actually thought kids were really the only ones who had ear infections until my mom had some serious ear infections where she actually had it burst, her eardrum burst.
Sure, yeah, absolutely, and that's in a child. You know, it's always in the back of my mind to think of other things other than just this thing that's staring you in the face. But it's especially true in an adult with an ear infection. An adult with an ear infection, it's not that common. And usually in an adult, there's something else in the mix. And again, typically it's something upstream from that, or a domino ahead of that last domino to fall.
What about snoring? I think a lot of people associate snoring with nasal and all that. Also sleep apnea, because snoring and sleep apnea are two different things, even though we've kind of come to start associating them, correct?
Sure, they're similar but different. I mean, you know, one's deadly, one's not, basically.
Right.
They're both annoying, but it just is. And so, you know, both of the action where that's happening at is in the throat, whether somebody snores or whether somebody has sleep apnea. Oftentimes, this is the same sort of wavelength, is oftentimes when I'm evaluating somebody who has those particular issues, you know, I don't just focus in the throat. We have to look upstream from there, look up at the dominoes ahead of that domino. And oftentimes they've got some nose issues that are creating some trouble for them. So their nose is blocked up, they're not breathing through the nose, they breathe through the mouth, and because they breathe through the mouth, they snore. And if you just focus on the throat, you're going to miss that initial step. The other side of that same equation, for somebody who has sleep apnea, there's something called a CPAP machine, which is how they treat their sleep apnea. The best, and I'd say really the only way that works well for most folks, is when it fits on the nose. And so some folks get the impression that the machine can't work for them because their nose is plugged up, and then you shove a mask on their whole face, and that's not going to work. And so you kind of, and a lot of folks sort of get scared out of getting the correct treatment for their issue because they don't understand why, you know, I've got a problem, I'm trying to treat it, why isn't this helping me, you know, and they don't know what to do. And so oftentimes, again, it's sort of taking a step back and saying, okay, yeah, I understand that we've got an issue with sleep apnea, I understand we have an issue with how we're treating that, but the issue may not be in the throat, the issue may be in the nose. And a lot of times, I'd say oftentimes, if the issue is in the nose and we fix the nose, all of a sudden that machine's their friend and their problems are resolved.
You brought up the throat. I think a lot of people associate tonsil problems when people have symptoms that affect their throat.
Yep.
What is often the real cause of people with chronic throat problems?
I mean, sometimes it's just as straightforward as that. So sometimes it is the tonsils, but same thing. I mean, you don't want, I guess at the end of the day, and I've seen many folks who kind of come to me on the back end of this, but you don't want to go through getting your tonsils out unless you have a good reason to get your tonsils out. And so I see lots of folks who have throat issues, sore throats, you know, just irritation back there, and everybody kind of blames the tonsils because that's what's back there. But if you kind of take a step back, look up ahead of that, that's the same thing, nose and sinuses. And so if you have a chronic sinus infection, that can mimic a chronic tonsil infection. And so the same thing, you get the drainage coming down, it's irritating, it's uncomfortable, it's the same sort of stuff. And if you're not focusing on the area, and if you're not looking into those areas, you can miss the boat.
You know what I like about what you're saying is that oftentimes I feel when you go to the doctor, they almost write you off. You know, you sort of say, these are my symptoms. That, oh, you have a cold. You know, you just gotta, you gotta wait it out. I like the fact that you're really pinpointing. You're going deeper. You're deciding what it is, and part of that is the fact that you have this in-office CT scanner, which is one of the only ones in Wisconsin to really help you pinpoint it.
Right, and so that's an advantage as far as being able to look in some areas that we can't. I can't look into the sinuses. Nobody can look into the sinuses without X-rays. This is something we have in our office, which not everybody needs a CT scan of the sinuses, but if somebody's having, for instance, if I'm on the fence whether somebody's got a chronic tonsil infection or a chronic sinus infection versus sort of assuming they don't have any sinus issues and going ahead and take their tonsils out, I'm going to at least bring it up and recommend at least looking at the sinuses to see. And if they check it okay, fine. We don't have to worry about them, and we know we're not missing the boat. And if they don't, you still might have both issues. You might have some tonsil issues and some sinus issues, but at least we know about it going into things.
I know you also look at people who have the vexing problems of asthma and headaches, and you try to diagnose those. And there are other specialized testing that you do that kind of helps you see beyond the obvious, right?
Well, I think those are big issues, asthma and headaches. Headache issues, for instance, there can be trigger points on the inside of the nose, which somebody doesn't have any idea that they're there unless we look and see what's going on. So if somebody has got chronic migraine headaches, they're migraine headaches, but you can have trigger points coming from the inside of the nose, which if you look, scratch beneath the surface, you can find those things and sometimes correct those things, and sometimes that's a very dramatic fix. Same thing with asthma. Lots of folks who have asthma, the same lining that's in the lungs is the same lining that's in the nose and the sinuses. And so if somebody's got trouble down below, they are oftentimes going to have trouble up here. Now, if we can help their cause up here, it's not necessarily going to cure their asthma, but it usually takes a lot of the weight off of their back. And so lots of folks that we can correct some issues nose-wise, sinus-wise, get them breathing better, get the sinuses working better. They've still got the tendency towards asthma, but that tendency isn't, sort of pushing over the edge. The tendency is drawn back.
I think it's obvious your philosophy is very different than what we're accustomed to at so many places. So for those of you who do have issues that you want to contact Dr. Madan Kandula, here's the information for Advent so that you can call and make an appointment with him. It's 414-771-6780 or visit advent.md online. They're located right on Mayfair Road in Wauwatosa. Thanks for being here, Doctor.
Thank you.
Good to see you.